There are 228 licensed nursing homes and 4 VA homes in Alabama with a capacity of 28,000 residents who are often elderly and either mentally or physically impaired. It's the state and federal government's job to make sure those patients are getting quality care. To do that, there are more than 40 inspectors in Alabama who make surprise visits to facilities around the state to make sure they're following the 522 distinct rules in this massive handbook.
They have to be in compliance with every one of these regulations at all times.
If a facility breaks a rule, they're written up in a statement of deficiencies and plan of correction report. We dug through those reports that are accessible online for the public to view, although they're not easy to decipher. We looked at deficiencies from over the past few years that were labeled as actual harm or immediate jeopardy situations, and we found 10 facilities in central Alabama where inspectors cited those issues. Fairhaven Retirement Center in Birmingham is one of them. It was cited for 2 incidents of failing to properly supervise residents. In one case, a resident fell out of a chair and cut her forehead. Only a few months later, a resident fell out of bed and broke a femur, or the thigh bone. The facility was fined almost $2,000. We wanted to talk to Fairhaven officials about the reports, but our interview was cut short when the corporate director of marketing said at no time were any residents in immediate jeopardy of harm.
I'm confused how you're not seeing what I'm seeing. What am I not seeing here?
I'm afraid we're not going to be able to do this.
The facility owners did provide us with letters from the Alabama Department of Public Health showing their compliance with regulations after the incidents and pointing out that the federal government has given Fairhaven its highest rating of 5 stars. But we discovered other incidents even more alarming. Atala Healthcare was fined more than $50,000 for failing to provide adequate supervision and not immediately notifying residents' doctors of inappropriate sexual behavior when a male resident was observed engaging in oral sex with a severely cognitively impaired female resident last year. Atala Healthcare officials had no comment. At Forest Manor in Northport, a nurse assistant wrote the word bath on the lower abdomen of a cognitively impaired resident. The resident's brother complained that it was undignified and embarrassing. Forest Manor officials didn't want to speak on camera, but they welcomed us and our cameras into their facility. The owner told us the person responsible for writing on the resident was fired. They also pointed out that the facility was chosen by the State Nursing Home Association as the 2013 Outstanding Healthcare Organization. The residents we saw there, like Betty Harless, seemed happy and well cared for.
I've been very blessed. I like it because of the residents, the friendliness of the employees. The social service department has been outstanding.
Right next door at Glen Haven Health and Rehabilitation, 2 residents fell repeatedly within just a few months in early 2012. The facility was fined more than $3,600. The representatives there wouldn't talk on camera, but sent us a statement pointing out their 4-star rating from the Center for Medicaid and Medicare Services. Birmingham Nursing and Rehabilitation Center was fined almost $120,000 after a resident fell, broke their hip, and the facility failed to notify their physician, so the resident wasn't sent to the hospital or given anything other than routine pain medication for almost 17 hours. That facility didn't respond to several attempts to contact them. In Bessemer at Oaks on Parkwood or Highland Nursing Home, a resident fell out of the bed and cut her face and suffered a subdural hematoma. Again, representatives wouldn't speak on camera, but responded with a short press release saying they strongly disagree with the findings in the report. McGuffey Health and Rehabilitation in Gadsden was cited when a resident who was supposed to be assisted at all times fell in the shower and suffered a head injury, cuts on her face, and broken facial bones. We got this statement from the nursing home saying they're challenging the deficiency and pointing out their local awards for excellence. At Coleman Long-Term Care and Rehabilitation Center, a resident fell out of a lift chair and suffered a head injury and cut. A statement from that facility says the issues have been addressed and resolved. Arlington Rehabilitation and Healthcare in Birmingham was fined more than $18,000 because certified nursing assistants weren't changing gloves and washing their hands properly when taking care of residents' catheters. The administrator told us off camera they had corrected all the deficiencies. And owners of Self Healthcare and Rehab in Hueytown released a statement about a report that the facility failed to take steps to prevent a resident from developing a serious pressure ulcer. Andy Self said the practice had already been identified and corrected. Even with these deficiencies, the medical director at the Alabama Department of Public Health says nursing homes in the state are in good shape.
There has been a vast improvement in the quality of care of nursing homes.
And Dr. Geary points out that when a home is cited, they must immediately file a plan to correct the problem.
We go back to do a follow-up survey and a follow-up survey and a follow-up survey to document that they have gotten back into compliance with the regulations, both state and federal. And if they have not, we meet with our attorneys. We recommend that their license be terminated.
We feel like we're doing a very good job. If you look at the trends and statistics that are tracked by the Centers for Medicare and Medicaid Services, which is the big umbrella government agency that oversees nursing homes, you look in all the categories where we need to be going down, deficiencies or other things, we're going down.
But lobbying groups like Families for Better Care see the situation much differently.
We're going to have this massive influx of baby boomers into nursing homes. Nursing homes have to do a lot better job than what they're doing.
If you're looking for a good nursing home for your loved one, you'll need to invest some time to do research. Look at these discrepancy reports online. You can compare nursing homes on the Medicare.gov site. Also plan to visit the facilities at off hours, even on weekends or holidays, and get past the lobby to see what's really going on and how patients are being treated. Also talk to residents and staff members. If you have an issue I should look into, email me at lcrane@WVTM.com. I'm Lisa Crane for Alabama's 13 Investigates. Talk to